What if I told you that one of the most effective tools for preventing a dangerous lung infection in hospitals isn't a high-tech machine, but your toothbrush? It might sound surprising, but this everyday item could be a true lifesaver for patients in hospital beds. While we often associate advanced technology and powerful medications with saving lives, sometimes the simplest solutions can have the biggest impact. Imagine a world where a basic act like brushing your teeth could make the difference between recovery and a life-threatening illness. Groundbreaking research now confirms that brushing your teeth could be a powerful defense against pneumonia for hospitalized patients. This isn't just a theory. Scientists have found real, measurable benefits. Pneumonia is a serious infection that can strike when bacteria from the mouth travel down into the lungs, especially in people who are already weak or bedridden. By keeping the mouth clean, we can dramatically reduce the number of harmful bacteria that might otherwise cause these dangerous infections. This isn't just a minor improvement. It could save lives and ease the strain on healthcare systems. Every year, thousands of patients develop pneumonia while in the hospital, leading to longer stays, higher costs, and sometimes tragic outcomes. By making oral care a priority, hospitals could prevent countless cases of pneumonia, helping patients recover faster and freeing up resources for others in need. The revelation comes from a major clinical trial presented at the European Society of Clinical Microbiology and Infectious Diseases Global Congress. This large-scale study brought together experts from around the world, all focused on finding new ways to protect vulnerable patients. The results were clear. Something as simple as regular toothbrushing can have a profound effect on patient health. For decades, hospitals have battled infections like pneumonia, one of the most common and deadly threats. Despite advances in medicine, pneumonia remains a leading cause of complications and death among hospitalized patients, especially those who are elderly or have weakened immune systems. Traditional prevention methods have included antibiotics and strict hygiene protocols, but these are not always enough. The study reframes oral hygiene from a comfort measure to a critical component of patient safety. It's not just about fresh breath or a clean smile. Brushing teeth in the hospital is now recognized as a frontline defense against serious infections. Nurses and caregivers are being encouraged to make oral care a routine part of every patient's daily treatment, just like checking vital signs or administering medication. The core idea is simple. A cleaner mouth means fewer harmful bacteria that can reach the lungs, especially in vulnerable patients. When oral hygiene is neglected, bacteria can multiply and easily find their way into the respiratory system, particularly in those who are unable to care for themselves. By brushing teeth regularly, we create a barrier that helps protect the lungs from infection. This study provides the strongest evidence yet that something as basic as brushing your teeth can profoundly impact patient outcomes. It's a reminder that sometimes the most powerful tools in medicine are the ones we've had all along. As hospitals around the world take notice, the humble toothbrush may soon become a symbol of hope and healing for patients everywhere. To understand this breakthrough, let's look at hospital-acquired pneumonia, or HAP. HAP develops at least 48 hours after hospital admission, meaning it's contracted inside the hospital. The study focused on non-ventilator-associated HAP, pneumonia in patients not on breathing machines. While ventilated patients have strict prevention protocols, those breathing on their own are often overlooked. NV HAP can affect anyone, from surgical patients to the elderly, making it a widespread problem. Treating HAP requires more resources, longer hospital stays, and powerful antibiotics. Preventing it is crucial for both patient recovery and hospital efficiency. Why are hospital-acquired infections so dangerous? 2 reasons: vulnerable patients and tough germs. Hospital patients often have weakened immune systems, making them easy targets for infection. Hospitals can harbor antibiotic-resistant superbugs that are hard to treat. When pneumonia strikes a hospitalized patient, it can quickly become life-threatening. The infection can lead to respiratory failure, sepsis, and organ damage, especially in the elderly or those with chronic conditions. Many patients are less mobile, allowing fluid to collect in the lungs and bacteria to thrive. Difficulty swallowing or coughing further increases risk. This combination makes hospital-acquired pneumonia a persistent and dangerous threat. The connection between oral hygiene and lung infections is more significant than many people realize. What happens in your mouth can have a direct impact on your respiratory health, especially for those who are already vulnerable, such as hospital patients or the elderly. Our mouths are home to billions of bacteria, some helpful, but many potentially harmful. These microorganisms live on our teeth, gums, and tongue, forming complex communities that can quickly get out of balance. Without regular and thorough oral care, harmful bacteria multiply rapidly, forming sticky layers of plaque and tartar. This buildup not only damages teeth and gums, but also increases the risk of bacteria traveling to other parts of the body. In healthy individuals, this might simply result in cavities or gum disease. But for those with weakened immune systems, the consequences can be much more severe. For hospital patients, especially the elderly or those with chronic illnesses, oral bacteria can become a serious threat, leading to infections like pneumonia, which can be life-threatening. The main culprit is a process called aspiration. This occurs when saliva, along with bacteria, is accidentally inhaled into the lungs instead of being swallowed. Once inside the lungs, these bacteria can trigger infections and inflammation. Hospital patients, particularly those who are sedated, bedridden, or have difficulty swallowing, are at much higher risk. Their natural defenses, like coughing and swallowing, are often impaired, making it easier for bacteria to reach the lungs. As Professor Brett Mitchell explains, every time a patient aspirates, the risk of infection rises if there are high levels of oral bacteria present. This is why oral care is so critical in healthcare settings. Brushing teeth and maintaining good oral hygiene can dramatically reduce the number of harmful bacteria in the mouth, lowering the risk of these bacteria being inhaled and causing lung infections. Even simple, regular brushing, whether done by the patient or with help from caregivers, can break the chain of events that leads to pneumonia and other serious complications. Ultimately, it's all about microbial control. By keeping the mouth clean, we not only protect oral health, but also safeguard the lungs, making a real difference in patient outcomes and overall well-being. To test this theory, researchers launched a large clinical trial across Australian hospitals. Over 8,000 patients participated, making the results robust and reliable. Patients received oral care kits, just a toothbrush and toothpaste, plus educational materials. Nurses were trained to integrate oral care into daily routines, not as an extra task, but as a vital safety measure. The program aimed to make oral hygiene a clinical priority. Researchers audited how often patients received oral care before and after the program. The goal: see if more brushing led to fewer pneumonia cases. The study's scale and design set the stage for remarkable findings. The results were stunning. Before the program, only 16% of patients received oral care. Afterward, that jumped to 61%. With more brushing, pneumonia rates dropped sharply, from 1 case per 100 patient days to just 0.41. That's nearly a 60% reduction in risk. For every 100 patients, more than half a case of pneumonia was prevented. Even brushing once or twice daily made a big difference. This is the strongest evidence yet that oral hygiene prevents NV-HAP. The intervention was simple, low-cost, and highly effective. Sometimes the most powerful solutions are hiding in plain sight. A toothbrush became a life-saving tool. What did this program look like in practice? Patients received a toothbrush and toothpaste at admission, signaling oral health as a priority. Mobile patients were encouraged to brush twice daily. Nurses assisted those who couldn't. Oral care became part of daily rounds, just like checking vital signs. Staff training shifted oral care from a comfort task to a clinical necessity. Educational materials offered practical tips for safe, effective brushing. Making oral hygiene routine helped counter dental decline during hospital stays. This simple habit became a collaborative effort for safer, faster recovery. The impact of this study goes far beyond Australia. Its findings have the potential to transform hospital care in every corner of the globe, from bustling urban centers to remote rural clinics. No matter where you live, the risk of hospital-acquired infections is a universal concern, and this breakthrough offers hope for safer, more effective care worldwide. For patients, this means a lower risk of dangerous lung infections like pneumonia, which can be life-threatening and often lead to longer hospital stays. Faster recovery times mean patients can return home to their loved ones sooner, with fewer complications and a better overall experience during their hospital stay. Families benefit too. They avoid the stress, anxiety, and uncertainty that come with unexpected complications. Knowing their loved one is less likely to face setbacks brings peace of mind and allows families to focus on supporting recovery, rather than worrying about new health problems. Hospitals also stand to gain. By preventing infections, They save valuable resources, reduce costs associated with extended care, and free up beds for other patients in need. This means more efficient use of staff time and hospital space, helping healthcare systems run more smoothly. Preventing pneumonia and similar infections means there's less need for powerful antibiotics, which are often used as a last resort. This not only protects patients from potential side effects, but also preserves these important medicines for when they're truly needed. This approach directly helps fight antibiotic resistance, a growing global health crisis that threatens our ability to treat infections. By reducing unnecessary antibiotic use, we help ensure these drugs remain effective for future generations. What's remarkable is that a simple, low-cost intervention like brushing teeth can make such a difference. It's easy to implement, requires minimal training, and can be adopted in hospitals everywhere, regardless of resources. This is a rare case where better care and lower costs truly go hand in hand. Hospitals can improve patient outcomes while also being more efficient and cost-effective, a win for everyone involved. The humble toothbrush, often overlooked, becomes a powerful tool for both patient safety and public health. Its role in preventing serious infections highlights how small changes can have a big impact. Sometimes, the simplest solutions, like a daily toothbrush, can lead to the most profound improvements in healthcare for everyone, everywhere. With such strong evidence, what's next? The challenge is scaling these programs to hospitals everywhere. Staff training, time management, and sustained focus are key. Hospitals should review infection control protocols and adopt standardized oral hygiene policies. Oral care kits may soon become standard admission items. Adding oral care to daily checklists could be a major advance in patient safety. This research empowers everyone in the hospital to prevent harm. The toothbrush has earned its place as an essential tool for safer, healthier hospitals.